Hi, I'm Dr. Kenneth Adams, and I'm happy to be hosting this episode of Matters of the Heart. It's brought to you by Haverhill Community TV and Pentucket Medical Associates Cardiology. Today I have the pleasure of having Dr. Seth Bilazarian on the show. Seth is going to be speaking about cardiac rehabilitation. It's been in the news recently, and it's a very valuable asset for many cardiac patients. Dr. Bilazarian?
Great. Well, thanks for that introduction, Ken. So the cardiac rehab programs are something that we've had for a long time in the area, and I thought that there's been this recent interest in it. January 11th article in the Boston Globe highlighted a recent paper that was about it. So let's put up that January 11th Boston Globe article and just briefly say that it talks about the value of cardiac rehabilitation and the value of actually going through a cardiac rehab program. So it highlights the story of a gentleman from Wellesley who had a heart attack, who was basically fit and didn't have a lot of risk factors, but sustained a heart attack, and how valuable for this one individual going through cardiac rehab. So that's, of course, one anecdote, but ultimately we want to have more information for our patients that we can provide through studies that I'm going to highlight here in a second. But first, just to take a moment and talk a little bit about what was the history in the past of heart attacks. Cardiac rehab is a program we're going to talk a little bit more about shortly, but basically it's a program that's 3 times a week for 12 weeks that most insurers, including Medicare, pays for, 36 total sessions, 12 weeks, 3 times a week, in which there's a really multidisciplinary approach to helping patients improve risk factors. There's supervised exercise, there's information about diet, there's information about medications, there's stress reduction, and the last, a lot of information about the importance of people being depressed after a heart attack, and there's screening for depression now and helping patients in that regard. But I think one of the best parts of the cardiac rehab program is just the camaraderie and the fellowship of being with other people who have been through a bypass surgery operation or an angioplasty or a heart attack, and seeing that other people are doing well in a program. So I think that that's probably one of the most valuable parts of the program. So cardiac rehab is really a wonderful and excellent program. But to contrast it, is I think very interesting that in the 1950s, when people had heart attacks, they were told to just go lie in bed, don't do anything. I can remember when I was in medical school in the 1980s that there wasn't much improvement on that. Patients were told to not even brush their hair after a heart attack for fear that just the stress of lifting their hand above their head could actually cause another heart attack. The problem with that is a variety of things, of course, is that patients being lying in bed often got other problems. It's said that the cause of death after a heart attack was often a clot that would form in people's legs and travel to the lungs, something called a pulmonary embolus that we've talked about in this show previously. So just putting people to bed is not necessarily the right answer either. And we also know that the earlier people become mobile and get back to their functional activities like working and doing other kind of things, the more likely they're going to have a long and functional life. So it's really been a key and important thing that's been very valuable for us to have the transition from the heart attack to full life, but use the transitional point of using this cardiac rehab program. So the cardiac rehab programs have really been around. We have a variety of options in our area. The nearest ones for our patients in Haverhill are either the Holy Family program in Methuen or a program at the Newburyport Hospital and at Jake's Hospital, both excellent programs for our patients. And as I said, these are almost always covered for patients after a heart attack, after an angioplasty, after bypass surgery, after valve replacement surgery. So the insurers have really adopted the idea that this is valuable for patients and can help prevent future problems. Dr. Adams, any thoughts about that?
Yeah, I was just, as you were talking about cardiac rehab, I was just thinking neither of us is old enough to remember the time when doctors told patients to stay in bed for 3 or 4 weeks after a heart attack.
Right.
And it really has changed dramatically that, we try to get patients up and around the same day that they come into the hospital because we're so worried about the pulmonary embolus problem.
Right. So with that, in addition to the changes that Dr. Adams described about the general difference in physicians' approach to wanting patients to be more active, of course, a lot of things have happened just in the course of treatment of patients with heart attacks. Patients with the most serious heart attacks are now going home often after 3 days. We're even pushing it closer to 2 days after being in the hospital. So patients are going home much quicker and, of course, have to assume a lot of the normal life activities, their own care, their own hygiene, shower, those kinds of things have to be done by themselves. Whereas in the past, patients would be in hospital for 1 or 2 weeks with nurses taking care of all of those sort of care needs. So that alone has made a dramatic difference. But as physicians, we still worry because patients often will take one of two tracks after a heart attack. They'll either assume that nothing has to change and they go right back to very physical activity, which is wrong, or they take the other track in which they're so fearful they stay in bed or become couch potatoes for fear. So those two extremes, we try to find the middle course of having really excellent nurses in cardiac rehab counsel people and encourage them. So they're sort of in the middle. They're progressing in a safe and appropriate manner, but they're not doing too much either.
One of the really nice things about having cardiac rehab programs available is when a patient comes to your office after having had a heart attack, and they want to know, what can I do, what can I eat, can I travel? And a lot of these questions get answered in cardiac rehab probably better than we can, because as they're in the program, they remember all these questions, and they're able to also talk with other people who've had the same problem. So I found it to be really helpful in that way, too. I
agree with you completely. And it's one of those things, though, and I guess we can talk a little bit about that in a second, is encouraging our patients. But I know you and I are very firm in our desire to have patients want to go to these programs. So what's the benefit of these programs? So other than what we've said, just trying to counsel people to exercise, we sometimes hear patients say, well, I know how to exercise and I know what to do. And it really is much more than that. We know that the data says that patients who go through a cardiac rehab program after one of these events have a reduction in death, actually dying in the next year or several years, of 15 to 28%. So almost a third reduction in the chance of death. And the chance of cardiac death specifically is even have a greater reduction in events. And we also know that the patients who go to these cardiac rehab programs are more likely to have excellent control of their blood pressure and cholesterol, because they're not only hearing it from the cardiologist and their medical doctor, but they're also getting the reinforcement from these nurses. They're getting their blood pressure checked, they're getting heart rate checked, they're getting the medications reviewed so that they know the value of these medications. So it's really, I hope making a strong case for our audience that if you happen to have a circumstance where you or a family have one of these problems, a heart attack, bypass, or angioplasty, that you will listen to your doctor and actually try these programs.
And not only does the communication go from the rehab nurses to the patient, but the rehab nurses will send us paperwork about how our patient's doing. Do we want them to advance in the program? So we're definitely kept in the loop.
Great. Thank you. That's a great point. I think that's really a valuable part of the sort of communication, of the teamwork effort of the care of the patient after these events. And of course, we don't want to underestimate the value of the dramatic benefit of just physical strength and stamina and endurance that comes from a commitment to exercise. So many of my patients, and I'm sure Dr. Adams will tell the similar stories, that patients were almost completely sedentary before their heart attack, and after they go through the cardiac rehab program, they are now really committed again to an exercise program because they actually feel the benefits. They feel better. They're not short of breath just doing daily activities like going to the grocery store or other kinds of things. So it's really been a dramatic benefit. So I think that's really the really critical part of these programs. One of the things that I think we find is that many times patients have a certain unwillingness to go initially, and that they will actually finally agree. One of my sort of tricks I'll tell patients, so the audience may hear this, so if they're a patient of mine, I tell them that they will should just try it for 1 or 2 weeks, and if they don't like it, they can quit. And I know from my own experience that if I convince a patient to try it for 1 or 2 weeks, almost universally they love it and want to stick with it. So it really is a dramatic benefit because patients really enjoy it. And besides these other benefits, many of our patients even continue after the 12 weeks or 36 sessions in what's called a maintenance program, where these rehab programs will allow patients for a fee, no longer covered by their insurance, to continue in the program once or twice or 3 times a week in a maintenance program in which they continue to be supervised, but they continue to get the benefits of the exercise equipment and their blood pressure checked and other kinds of valuable resources that these experienced nurses can provide. I would like to just briefly show one of the benefits of physical activity. We have a graph of self-reported physical activity. And basically, briefly, this graph just shows what I think most people know. If on the left you see if someone's inactive, a group of patients who are inactive don't really do anything. They're what many people call couch potatoes. Their chance of death is up in the 40 to 50% range. But if they even do light activity, it falls dramatically. It doesn't really matter whether they do light, moderate, or moderately vigorous activity. Their event rate falls from the 40 to 50% range down to the 10 to 20% range. So we know, we've emphasized in past episodes of Matters of the Heart, we've talked about the value of exercise, and I think that there's no doubt this kind of data is out there, and it's really strongly advocated that people do it. But we know that patients have certain hesitancy. They don't know how to start. They don't know what to do. So I think sometimes it's actually an advantage, a good fortune, a blessing for a patient to have had a heart attack or one of these events, because they have this opportunity to sort of get straightened out. Whereas if they didn't have this event, they would have continued on their previous unhealthy lifestyle of being sedentary, and now they're able to sort of get straightened out and prevent a future problem, a problem that in many times might have been much more severe, including death or other kind of significant problems. I'll just show the next slide. It's just the patients who are eligible for cardiac rehab. I've mentioned these briefly, but it's the patient who's admitted for a heart attack or myocardial infarction, patients who had bypass, patients who had an angioplasty. The doctor term for that is percutaneous coronary intervention. Patients who have stable angina, patients who have had a heart valve surgery or replacement, and patients who have had a heart or a heart-lung transplant are all candidates. The top three, of course, are the most common reasons why we as cardiologists in the community send patients for the cardiac rehab programs.
Yeah, let me just add one thing. You may be getting to it in your talk, but patients also ask, Doc, is my heart strong enough for me to participate in exercise? And it turns out that even if you've had a large heart attack and a weak heart, you still benefit from cardiac rehabilitation.
Great, I agree. I agree with you completely. But I think we would both agree that those patients are the ones that we're most enthusiastic of being in a supervised arrangement. So a patient who has a very weak heart, who sustained a very large heart attack, and we actually do know that those patients are very at risk. I agree with you completely. They do benefit by exercise, but those are the patients I'm most nervous about.
Exactly.
If despite my recommendation, say, oh no, I can do it myself, I'll take care of this, I'll go out.
Yeah, those are the ones we most want in the rehab program.
Exactly right. So the next slide I'll just briefly talk about. We talked about some of these advantages, but according to guidelines, the most substantial benefits, let's just review those together. Improvement in exercise tolerance. Of course, if you exercise, you have greater exercise tolerance. If you couldn't climb a flight of stairs, if you go to a regular exercise program, you'll be able to climb 2 flights of stairs. Improvement in symptoms. Symptoms of shortness of breath and other symptoms will improve with exercise. Of course, if you exercise, your cholesterol or lipid levels will improve. Part of cardiac rehab, which I didn't mention, is a smoking cessation education about really trying to help patients get through the effort of actually succeeding at quitting cigarette smoking. Improvement in psychosocial well-being and reduction of stress. Stress reduction and counseling strategies to handle the stress of both personal family crises as well as professional stress. Many of our patients are dealing with professional stress related to work-related problems, not having work. Those issues are really handled quite beautifully in cardiac rehab. And one thing that our cardiac rehab programs are now doing is screening for depression. We know that if you have depression after you have a heart attack, you're at much higher risk of serious problems like another heart attack or death. And being screened for depression and getting proper treatment for it is a very valuable thing. And then the last thing I already mentioned, of course, we can't neglect the most important thing. If you go to cardiac rehab, you have a less chance of dying. I mean, who wouldn't want that benefit? So you and I believe in this. We think that it's valuable. We have data, which I'm going to review in another second, some data that came out recently in the last week or so in one of the major cardiac journals. But why don't we succeed? Well, I think both of us and our colleagues are good about wanting patients to go. We succeed at telling them, but like any compliance issues, like with other medicines and whatnot, sometimes patients won't follow through. So hopefully this will serve as a strategy to encourage patients to be open to it. Do you have any thoughts about that?
Yeah, for some of the older patients, transportation always becomes an issue. And unfortunately, we don't have a way to get some of these patients to and from their program. They rely on family members, and that I found has been an obstacle for some patients. But if we can somehow get them there, they all seem to enjoy the program a lot.
Okay. So I thank you for reminding me that, of course, is a really important thing, and unfortunately, our public transportation system has some limitations here in the Merrimack Valley and is a difficulty for our seniors. But the data would suggest that Medicare recipients, Medicare patients, when they look at large numbers, thousands of patients are looked at after a heart attack, the number of patients that actually get referred, or I shouldn't say get referred, but actually go to cardiac rehab, actually attend a cardiac rehab session, ranges from a low of around 13% to a high of 50%. So at best, only 1 out of 2 patients are actually getting referred after a heart attack for these programs. So it is a definite problem.
I wonder if some of that is because our treatments for heart attacks have gotten so much better. You as an interventionalist will refer patients to you who have a heart attack, and we find a blockage. You fix the blockage, and they feel great. So they're ready to go out and do all kinds of things. They say, well, gee, why do I really need rehab? I feel better now than I did 6 months ago.
Right.
But it is important because we like to have them under supervision, at least initially.
Right. And I think what you're saying is very true, but it is a concern that I have about things in general. In the past, a heart attack was a death sentence. In the 1950s, 1960s, you had a heart attack, you were either going to be dead or disabled. You didn't go back to work. It was just horrible. The pendulum's now swung so far over, as you say, that so what, I had a heart attack. And in some extent, yes, so what, you had a heart attack. You didn't have much injury. You've had a good recovery. You have an excellent life expectancy. But if you don't make changes, you're not going to do well. And that's what we really fear. So I do think that we are sort of a victim of our own success. The patients are going home. They look great. They feel great, that they don't want to make these changes. And I guess that's the value, I think, of these cardiac rehab programs. So as you said, there are a lot of different things, and I know that you have a real interest in quality and following things with regard to delivery of care and quality delivery of care. But this is one of the measures that is really being looked at by national groups. The National Institutes of Health is looking at this, that why is there a gap for something that we have that's very good, it gives excellent results, it's not very expensive, it's good on a whole number of different ways, but we're not delivering it. It's called a gap. Why is there a gap in this care? And if it's 13% or 50%, whatever it is, there's a big gap. And I think some of it is, as you said, a lot of our younger patients want to get back to work. They can't afford time out. Some of our older patients can't get there because of transportation issues. There's a variety of sort of non-medical but important reasons. But at the end of the day, we aren't doing as well as I think we could for this really impressive results to decrease the gap. So there's a variety of things that are being looked at to try to drive these numbers to a higher level. The rehab programs that are certified in our area have very high quality standards, so I would just use that as another selling point for our patients. You and I aren't involved in the direct management of these programs, but we know a fair amount about them and would say that they're excellent programs in terms of having good directors as physicians who could give good oversight, excellent quality nurses who are well trained and committed to the program. And we, of course, the most easy way of evaluating is we, of course, ask our patients when they come in follow-up, how are they doing? And they say they really love the program. So for all those reasons, we would say that the programs are really of excellent quality. I would say that there's some other general things that I would say is that there are guidelines that have been written that are available, that if people are interested are available on the web. From 2007, a large database was generated on how cardiac rehab should be performed. The people are interested and want to find out more. But I will just now focus on the most recent paper that I started this whole discussion about, that was highlighted in the Boston Globe, a paper that was presented in our cardiology journal called Circulation, that looked at a very simple parameter. And the parameter was how many sessions of cardiac rehab did a person go to. I mentioned to you that the amount that most of the insurers like Medicare pays for is 36 sessions. Mm-hmm. That's 3 times a week for 12 weeks. But it looked at patients who attended 1 or 12 or 24 or 36 sessions. And what they did is they looked at a very large database. They looked at over 30,000 patients who had attended cardiac rehab, who had had a heart attack, and looked at how patients did at these different programs. And what they found, and we could just go to this slide, it's the patients who attended these 36 sessions of cardiac rehab. We have a slide. And what they showed was, this is just the highlights of it, if a person attended 36 sessions and they compared it to the patient who attended 24 sessions, so that's a patient who attended 3 times a week for 12 weeks, for instance, versus someone who attended 3 times a week for 8 weeks. And the patient who attended the full program had 14% lower risk of death and a 12% lower risk of another heart attack. An MI is another heart attack. If the patient attended 36 sessions and we compared it to a patient who only attended the 12 sessions, they had a 22% lower risk of death and a 23% lower chance of another heart attack. But the most striking difference is if you had 36 sessions, you went to the whole program, and you only went to one session. So you went to only one session, really didn't do the program. You went one time, and then you quit. Those patients who went to the 36 sessions had a 47% lower risk of death, almost a half lower rate of death, and 31% lower risk of another heart attack compared to the patient who only went to one session. Really a dramatic benefit of this kind of an intervention, which we know. And I think one of the things that this highlights, which reminds me to just talk about here again, is a lot of times all of us, human beings, patients, doctors, we want to sort of focus on one thing. I think it's sort of easier. Okay, well, I'm a smoker, I'm just going to quit smoking. I would think that that's very important and very valuable. I'm not discouraging that. Or they just have a high cholesterol, they're just going to focus on cholesterol. And what I think that we know from a lot of data, but the cardiac rehab really highlights, is that if we make even small or modest benefits in everything, we're really much better off. So patients who go to cardiac rehab and exercise, they lose a little bit of weight. They're exercising a little bit more. Their cholesterol gets a little bit better. Their blood pressure gets a little bit better. They're quitting smoking. So all of these different parameters add up. And I think that the way that we think about these risk factors is they're multipliers. So if you multiply a little bit of a benefit of cholesterol, a little bit of benefit of blood pressure, a little bit of benefit of exercise, we add up all these two. It's a dramatic benefit, as we can see, a 50% lowering.
Yeah, I agree. Those are fantastic numbers. And there's very few things in medicine overall where you can promise people that kind of benefit, and this is an incredibly safe intervention that people enjoy.
Exactly.
So it's hard to find anything wrong with it.
I agree. So why? So again, why do we stink at it? I mean, when we say we, why does the American healthcare system stink at this? And it could be just the mundane things like transportation, other kinds of things, but it really is dramatic.
I'm happy to see the data that you're presenting for the full program, because in the past, some insurance companies would only cover a month or 6 weeks, and it looks like it's really important to get the patient involved for the full 3 months.
I agree, because what happens, I think, and I know that you were previously a cardiac rehab director, so know a lot about this, but I think that the way the rehab program is set up is it's sort of a rolling program where there's a certain amount of information about stress reduction, a certain amount of information, and it's constantly cycles because it's assumed the patient will be there for 12 weeks. So that if you're only there for a month, you may miss the stress reduction portion, or you may miss the instruction about exercise. So I think that's probably a big part of it. So the next slide I just want to point out is the graph of how this looks. So what happens over time is if you see over 4 years, that what happens is that the top curve is those patients who only attended one rehab session, 1 to 11, those patients had almost a 20% event rate, whereas the patients who went to the 36 sessions on the bottom, they had only a 10% event rate over 4 years. So reducing from a 20% event rate down to a 10% event rate over 4 years is really quite impressive. And I would also add is that the curve is cut off here at 4 years, but you can imagine as time goes by, those curves are continuing to diverge. So I would assume, it's a guess on my part, but if the curves are separating at 4 years, they're going to keep separating. So at 8 years and 10 years, you will see continued benefit because the rate is going to keep rising at a faster rate for those patients who did not attend cardiac rehab compared to the patients who did do the full program. So I think that hopefully I've made a compelling discussion about cardiac rehab and about the values of the cardiac rehab program, and I'm hoping that if someone does unfortunately have a heart attack or need bypass or angioplasty, that they will get what I consider to be really the full benefit of those treatments, the bypass and the angioplasty, by going to cardiac rehab. In this day and age, I think that there's a lot of concern about healthcare resources, which is appropriate. We should be concerned about healthcare resource. If we're going to spend whatever the cost is, $20,000 or $30,000 or $50,000 for a bypass or an angioplasty or heart attack treatment, it's a shame not to get the added benefit, the full benefit of that cost by going to cardiac rehab and getting the reduction in future events by doing these other really small things in the long run that really help patients.
You've made a lot of great points about cardiac rehab. I just wanted to reinforce one thing that you said, and in terms of once you get the patients there and their lifestyle changes a little bit and they lose weight, their blood pressure goes down, their cholesterol gets better, and we're hoping to establish this as a lifelong pattern for them. And I think the enthusiasm that the rehab nurses bring to the program and the camaraderie really makes the patient want to keep this kind of thing going.
I agree with you completely, and they have done such a good job, these programs. I mean, there are national associations that evaluate them and accredit them, and these programs are both accredited in our area. And one of the things that's done is and understanding that as someone approaches that 36th session, that they're transitioning into some other program. They go to a local health club, they come back and do maintenance program, and that, now that I'm saying it, may be another reason why the patients who complete the program do better than the patients that don't, because if you just drop out after the 10th session before you finish, you never sort of got the encouragement to go to a local health club to continue your own exercise program.
Exactly. Yep. And it's so nice for patients to begin their exercise program on the heart monitor at rehab, and then during rehab they'll eventually wean off the monitor so they don't have to be nervous when they're joining a health club after the 3-month program. So that's another nice thing.
Great. So again, I hope that this was a compelling, convincing argument for being receptive to really making an honest and earnest effort to go to cardiac rehab. I hope that there'll be spouses out in our audience who will put the strong arm on their family member to attend cardiac rehab should they be somebody who goes through angioplasty or bypass or a heart attack. And in the long run, I think that the health benefits are extraordinary.
Yeah, thank you. I think you made some great points about why we should all be thinking about sending our cardiac patients to rehab. And I would invite anyone to send comments to us and to the program at Matters of the Heart 2. That's Matters of the Heart number 2 at Verizon.net. This is Kenneth Adams, and I've been hosting Seth Bilazarian, who has been talking with us about the value of cardiac rehabilitation. And we look forward to seeing you again. Again, this has been brought to you by Haverhill Community TV and Pentucket Medical Associates Cardiology Department. Thank you very much.